mute that so we're not getting that feedback.
All right, I hit live. It says live video starting, so hopefully, let's see. Okay, it says we're live.
All right.
Hey, everybody.
Hey.
Let's double check. Annie, I guess you're double checking.
Yep, let me refresh this.
Okay. All right. Maybe I should turn it on too,
Yep.
just so I can. It's in there.
And
Okay.
Tolson is live.
Perfect.
Okay. Hey, everybody. So I'm Kim Tolson. Some of you might not even know me. I'm the admin of this group. I started this group back in, I guess, 2020. I started this free group because, I was trying to figure out telehealth and COVID and telehealth billing and all the crazy stuff that was happening. And I was doing it in my own practice. And I had started my Bill Like a Boss program at that time. And I was like, we just need this group to help all the clinicians navigate telehealth. And really, it's evolved into this amazing free community that I've really been running by myself with the help of Julie, who's been our moderator for quite some time. But in my signature program, my premium program, Bill Like a Boss, I have had these three amazing women helping me for, we were just talking about this before we came in here, about 3.5, 4 years. They've been the billers inside of Bill Like a Boss, like really the backbone of Bill Like a Boss and helping all the members that have come through our program. So what we've decided to do is bring Annie, Dawna, and KP into this free group as part of the admin team over here. So you're going to see a lot more interaction from the admin team, a lot more correcting the incorrect information. A lot of people post things in this group that's just not true. It's not correct. So they're going to be the team helping me like run this group and make sure that we're helping you guys to the best of our capacity. And then of course, we're still running Bill Like a Boss every single day, like champs. Really, they're running it for me. They're doing everything because they're amazing. But what I wanted to do today is just have you guys introduce yourselves and tell everyone who you are so they get to know you a little bit better. I would just say that they're not just billers, they're also therapists. So they're a very unique unicorn that we've got here on our team here in this group, and then also inside of Bill Like a Boss. So I'd love if you guys would just kind of go around and introduce yourselves, let everybody just know a little bit about you and what you do and how you help us in Bill Like a Boss and how you're going to help us here in this group as well.
Okay. Well, thank you, Kim. And yes, it's kind of crazy to think that we've been doing this for so many years. It's like flying by. But I'm Dawna Haswell, and I'm the owner of A New Dawn, New Beginning. And A New Dawn, New Beginning was originally just me as a therapist trying to figure out how to run private practice. And then I started getting more and more referrals and realizing, okay, I need help, and I don't like to be solo. Like I like to have colleagues and like talk about things and have that resource. So it morphed into a group practice. And so we are actually in rural Florida, in the Panhandle, and we have several therapists. We have medication management. So it's kind of just like turned into this big thing. So what started as just me trying to figure it out is now a bigger thing. And in that, kind of like Kim, I was trying to figure out billing. And so after like not getting paid for the first few months, I was like, something's got to give. So the interesting part is I actually found Kim on Bill Like a Boss, and I was trying to figure out some things and learn some things, and take some classes. And that's when I was like, okay, I need more help too. And so I brought Miss Annie on. And Annie and I we've learned it from the bottom to the top. We've been in all aspects together to learn it. So whether it was just adding one therapist to 5 therapists to medication management, like we've kind of been around trying to figure that out. So I hope with that background, that we can kind of bring that perspective as well of like being solo into groups and the things that I wish somebody would have told me that would have been helpful along the way.
And then did you say this, Dawna? You guys expanded into your own billing company now, right? You're not only the therapy practice, you're also a huge billing company at this point with helping therapists doing their billing for them if they don't want to do it on their own too.
Yes,
right.
We are. Yeah. Thank you, Kim. Yeah, we did. So when I brought Annie on, that was Annie's role. I was like, listen, there's a lot of us therapists and we just didn't learn this. So I think I want to be able to help, but I need help. And so that's where Miss Annie came in.
So I joined in what felt like the height of COVID in July of 2020. And so a lot of looking at spreadsheets and going, what in the world am I looking at? But in that, and kind of like learning just a new dawn, a new beginning kind of therapy side and cleaning up some kind of issues there and finding some more issues to clean up there. I actually kind of went to Dawna and talked to her about the degree that I had. So I see both sides of that as well. So I'm a registered intern with the state of Florida. And so carry a pretty small caseload, but then also not only with a new dawn, a new beginning and bill like a boss, but we also have that virtual assistant company where we offer billing services, a lot of times some cleanup services, and some of that credentialing for different providers, different provider types across the country. So Dawna kind of touched on this. We've seen a lot. And every time I think that we've kind of seen it all, something comes out of left field and we just figure it out together. But I will say that Dawna's done a really, really good job of creating not only just like on her therapy side, a good community, but also kind of like her and Kim, this community of having some things that may not have been clear and kind of clearing some of those things up to then kind of like going back to those contracts and those manuals to actually go back to the source and find that correct information.
Yeah, absolutely. Yeah. Amazing. Thank you, Annie.
You're so welcome. And then KP is also kind of in a unique position. So I will let her introduce herself.
So I'm KP. I started at A New Dawn, A New Beginning. I think it's like a little over a year and a half ago. I started as an administrative assistant, so kind of doing the admin side of A New Dawn. And then kind of once I got worked into that, I slowly started working into the billing side. And I will say I feel like I'm in a great position to learn both kind of the therapy aspect and the billing as well, because I get to learn from these two wonderful ladies. So I feel like I have the best teachers in that aspect. And then I'm actually starting my grad program for social work this fall. So hopefully I'll also get to kind of have that aspect as well. So yeah, right now I just kind of do the administrative side as well as the billing, kind of helping with the billing company as well. So yeah, I kind of get to do a little bit of everything and I get to learn from the best. So
absolutely. Yes. Oh my gosh. Okay. I love working with these ladies. They're just diligent in getting the right answer, which I love so much. So inside a bill like a boss, you guys might not know everything that we do in there, but really our signature thing that is just amazing is every single week we have a live billers meeting, and it depends on who's available. Usually it's usually two of the four of us in there. And lately, really, it's Annie and KP run our live billers meeting. Could y'all tell them just like what the billers meeting is so they get an idea of, what's inside a bill like a boss too?
Yeah, it's super informal. Some people kind of put questions in the Facebook group. And then if there's any kind of follow-up or if that kind of answer from us for a different question, we kind of talk about it there. Some bring certain billing situations that happen there. Inside of those meetings, we have administrative assistants that attend, we have billers who attend, we have providers. So it's a pretty good mix. And sometimes it's just kind of like that round robin of, I think I'm moving in the right direction. I just need someone to kind of confirm that. Or if I do have a kind of a mistake in the process, helping me find that. And a lot of times what's really been neat lately is what one therapist kind of like brings to us as the admin team sparks another question or maybe another follow-up, or they've found themselves in a similar position and they're kind of able to offer some insight to that as well.
And that's every single Wednesday. We offer this live meeting and it's so valuable. Oh my gosh. And even inside of, we have a really robust training hub with, I don't know, would you guys say like probably over 40 different trainings on all the billing topics, and then like all the private practice topics that we've over the years, people have asked us about it. So inside a bill like a boss, frequently during these billing meetings, somebody will say, what is secondary billing? How do I do that? So we immediately say, okay, we need to obviously do a training on this. So over the years, we have built a really huge library of billing trainings and then everything else. For example, Annie and Dawna, since they run this huge practice, they also are really good at systems. So, one time we had them come in and just do like like systems 101 for running your private practice and your group practice and how to manage all that. We have a 3-part intern billing webinar that, because that comes up all the time, doesn't it, guys? Like, how do I bill for this?
How do I start?
How do I start? How do I find them? How do I pay them? All of that. So we totally cover all of that because these people are in there doing it all the time. And if there's anything we don't know all the way, we always bring an expert in. So we just had somebody come in and teach us about psychological testing and how to bill for that and how to get paid for that, which was a super valuable webinar. So we're always doing this. And if it's not billing related, we will do a different training. But the really cool thing that we've decided is for this community, we don't do a lot of trainings for this community, and we want to get better at that. So Annie and Dawna have decided they're like, we want to get back to this community. We want to help, even if they're not in Bill Like a Boss. And they've decided for the next year, I think we've got it scheduled out through at least December, a free training every single month for the members of this group. And on the newsletter as well. So if you're on the newsletter, you'll get reminders about this too. But what I'd love to do is just tell you guys what we have coming up, because I'm really excited about it. I cannot wait for them to offer these trainings to you all. So let's see, let me pull up my notes here so I remember everything. So coming up on June 18th at 11:30 a.m., and this is all Eastern time, we are, Annie and Dawna are going to do a training on credentialing and contracting sample credentialing application to walk you through that process. It's live. You can come in, you can ask questions. They're the expert on this stuff, so they're going to help you with every aspect of that. It's free. The only caveat to any of this stuff is you do have to register on our newsletter, and I'll drop the link down here in the comments. You have to be on the newsletter to get the link to join the free trainings, because we're not going to be streaming them live here in the Facebook group. They're only going to be for people that sign up through the link, because we want to, welcome you into the Zoom room and be able to talk to you and all that stuff. It's harder to do that live here on the Facebook group. So we're doing that. And then the next training is going to be on July 16th. And that is what's new for 2025. We're going to talk about coding and policy updates, CPT code changes that have happened recently, reimbursement adjustments, ICD-10 updates for mental health and behavioral health. There have been a lot of new codes emerging, new ways to bill. It's always evolving. And these ladies are really on top of this. So they're going to give you some updates to make sure that you're up to date and you're billing to your full capacity to make sure you're getting paid what you should get paid. Right?
Yes.
Yes. And then August 20th, we're going to have clinical documentation training. So Annie and Dawna obviously are experts at this. They run an entire group practice. They make sure their clinicians are documenting correctly. They've been through audits, so they know how to do this really well. So we're going to offer that free training on August 20th, how to do compliance and documentation. And then on September 17th, we're doing navigating audits and risk adjustments. So they're going to talk about what's the difference. That there is a difference between an audit and a risk adjustment. What is it? What are you required to send? How do you handle these when you get these requests? These are happening a lot more lately. Even these pre-assessment audits that they're doing before they're even letting clinicians see clients these days. I know in Illinois, Chicago specifically, this is happening every day to clinicians all over the place. So, talking about all of that and giving you guys information on how to handle that stuff. Again, free training. Amazing that you guys are doing this. And then on October 15th, they're going to do logistics for bringing interns in. So we're going to give you sort of a high level of, those 3 really detailed trainings that we have inside of Bill Like a Boss, but a high level just to get you started and get that information, give you that information so you can get started with that if you want to. Insurance guidelines. What's a qualified supervisor? What is supervision? How do you manage that? They're going to cover all of that. On November 19th, systems review. Like I was talking about before, they're going to do an updated systems review, and this would be a really good one to come to live. So you can ask questions about how do I manage this? How do I manage that? The new client process for onboarding, outstanding billing. How do I handle that? How do I track it? How do I manage it? Audit tools, all of that is going to be available in this training. So I'm super excited about that. And then billing for nurse practitioners will be on December 17th. So now that we've learned, we're putting this into practice. And Annie and Donna, I think y'all have prescribers, right? Or one or
We
two
do.
prescribers that you're billing for. So
Mhm.
they are experts with billing for prescribers and bringing them onto the practice and that sort of thing. So they're going to talk about that as well. And that's going to be covering like E&M codes. We get that question all the time. Well, can I bill a 9792 or whatever, and we're like, no, that's an E&M code. And they're
Yep.
going to talk about what is the difference. Prescribers can, therapists can't.
Mhm.
Talking about all of that and how you manage it. If you're managing a group practice, if you want to bring a prescriber in, we're going to talk about all of this to walk you through it.
Mhm.
Yeah.
So that's through December. And what we do is, we plan these based on the questions that a lot of you ask in the community. It's like, it looks like there's a need for this. So we want to touch on this. We want to offer these trainings. And we're going to continue to do these. So after December, we're going to have a whole new list that we're going to give you guys. So we want to give you guys a lot of value in this group, as well as our Bill Like a Boss members. And they already know we have a ton of value in there. But anyway, so those are our trainings. We're super excited. This is our new admin team. You're going to see them answering questions. Annie and KP are more like in the trenches in our group here. They'll be answering. Donna pops in every once in a while. If you need an admin, tag one of us and we will help you and try to help guide you through what you're struggling with. And of course, all the other wonderful members of our community help too. So we appreciate everybody that's in here, like kind of crowdsourcing answers and trying to help in the free community too. We really appreciate that. But anyway, is there anything else you guys want to say or anything?
I think we're just really excited I think we've learned the most from kind of like being in those positions and literally like your back is up against the wall and just have to figure it out. But we also know how scary that can be. So we definitely want to help you guys through that and help ease, some of that for you, and just be there to support you.
Yes. Thank you. Yep. Anybody else?
I'd say I think we're really excited. I know, I will tell you, Annie and KP, like I'm definitely in the background helping, but those two right there are golden. So when you guys get them, I know that even through our New Dawn, New Beginning VA company, like Annie does Zoom calls and helps clean up all the time, and so does KP. So I'm telling you, like, there's not a question that you can't come ask them, because if they don't know the answer, they're great at figuring it out and getting on those phone calls with those insurance companies, which none of us like to do. Let's be honest. Those two are great at it. So again, if we can help, please always just let us know how we can help.
Yes.
Yeah.
I think we're just super excited, and especially with the webinars and with the billing meeting, kind of like Amy was saying. And the Facebook group is great to, ask questions, kind of something that we're not sure about, but it's really great when you can kind of go in like a Zoom room like this and really just kind of brainstorm your questions. And if it's something me or Annie or Donna don't know, sometimes another biller will say, hey, I just had this happen last week. This is what happened. So it's really nice to kind of have that community that you can kind of bounce ideas off of each other.
Yeah.
Yes. And lastly, I want to say I'm going to drop another link down here, and that is for a 15-minute free consult with Annie. So Annie is graciously offering these free 15-minute consults to see, do you need help? Do you need to hire a biller? Do you want to do it on your own? Would Bill Like a Boss be a good fit for you? We'd love to meet with you all and just sort of assess what's going on and see how we can best guide you to the right resources that are going to help you with what you're trying to do inside of your business. So we're available for that. The link will be down under here too, so you guys can sign up for that as well. Okay.
All right.
Well, thanks. Well,
hopefully that we will see you guys soon, and drop your questions or anything that you guys have for us.
Yep. Thank you. I'll talk to you guys later.
Right.
Bye, everybody.
Thank you.
All right, let us know if you have
Bye,
questions. Okay. Bye.